But who has to do braces? Who does braces in
Why
all?
are you so controversial? Yeah. And gaps, they are mostly genetic. You find that there's a few people in the family that will have it. Yeah, some people say, I just don't want to look like Malume anymore.
Oh, yeah.
One or two people have said that. There's this relative of mine who has this thing, and the people identify. Yes. So they say, no, we don't want it.
Vaping and habli.
Yeah.
Are they as bad as the normal smoking that we know?
That's political.
Yeah.
It's controversial.
Yeah.
I'm not an expert on the subject, but I have heard that they are bad. Plus, we know that vaping, especially hablis, they transmit certain viruses like herpes. The funny thing about these new brushes is that there are some that are connected to apps. And it can give you an entire month report of how you've done, how you were brushing. And you can submit that to your dentist just to impress them.
One more week, one more episode of the Professionals Network podcast with myself, Theo Mapheto. This is a platform where we say what we like and we like what we say. We bring you professionals from all walks of life. Today is no exception. We bring you the good doctor, Dr. Kometsi Mokuele. Doc, welcome to the podcast.
Hi, Theo. Thanks for having me.
Thank you very much. Doc, you are a dentist.
Yes, sir.
What does a dentist do?
A dentist looks after the oral health needs of patients. And when you encompass other things, we go into communities and there may not be patients yet, so we do oral health education, Yeah, yes. That's what we do.
And you work for Sunset
Dentistry, yeah.
Sunset Dentistry. You guys have a lot of offices.
Yes, unfortunately.
You're all over the place.
Yeah, no, it's a headache.
Yes.
It's a nice headache to have, but after time, it's stressful.
Yes.
Yeah.
And how long have you been running this practice for?
I've been practicing for 27 years, and but with Sunset Dentistry, I've been for 4 years now.
Yes. You loving it?
I'm liking it.
Yes.
Enough to retire soon.
Yeah. Now, I want us to talk about dentistry.
Yes,
you know, there's a lot of myths that I think we have to debunk today, right?
Yes, sir.
Dentistry, how is it different from somebody who's an orthodontist? Is that the word?
Yes.
Orthodontist. Yes.
Dentistry is believe it or not, is a 5-year junior degree. It used to be 5.5 in my years.
Yes.
We always found it funny when you call it junior degree.
Yes.
Then it's equivalent, I think, to an honors.
Yes.
And then
yes, 5 years equivalent to an honors. Yes.
Yeah, you can do after that. You can do a master's.
Yes.
Yeah. Then the people that are orthodontists would have done a clinical master's in orthodontics.
I see.
So there's an MSc master's where you are not necessarily a specialist afterwards, but you just have a master's.
Yes.
And then the dentistry is the junior degree. So there's a few other disciplines that are covered in dentistry. You can become a maxillofacial and oral surgeon. Yes. The most common thing they do is they do wisdom teeth.
Yes.
And then they do jaw surgery and other things that involve surgery of the facial area.
Yes.
And then they do implants, blah, blah, blah.
Yes.
And then you can become a prosthodontist where you examine patients, recommend and install prosthesis according to your analysis. Prosthesis would be artificial teeth in this case. They could be artificial limbs in other cases.
Yes.
Yeah. And then you can become a periodontist where you look after the supporting tissue of the teeth, which is the bones, the gums, and the likes. So then when the gums are too difficult for us to treat, we refer them to a periodontist. And then there's other specialties.
Yes.
Yeah.
I told you that in the recent past, I had to do an op because I had what they call an impaction on my wisdom teeth. And there was a maxillofacial
surgeon
who worked on me.
Yes.
I see. So it's different.
One of the specialties.
It's one of the specialties.
Yeah.
I see. But who has to do braces? Who does braces in
why
all?
are you so controversial?
Yeah. No, because I see a lot of people are wearing braces now, by the way.
Yes.
So maybe let's start from the top.
Yes.
Why are braces necessary?
Braces are one of the ways you could align teeth. Teeth become crowded, teeth become malaligned. Jaw relations don't relate. Sometimes there's classes of classifying them.
Yes.
So people normally call this an overbite, but
Yes.
it's actually an overjet. This is an overbite.
I see.
Yeah. So,
but we always say it's an overbite.
Yeah, they say I've got an overbite.
Yes.
Yeah, correct. Yes. So then braces are one of the ways you could align teeth.
I see.
There are many other ways.
Mm-hmm.
Okay, and then there's as well. So braces are necessary to align teeth.
I see.
And give you a good smile aesthetically, make you functional. When your teeth are like this, you can't bite an apple.
Yeah.
Because they don't occlude. And then also form the way your facial relations of the jaws and the teeth, they must be in harmony. So we correct that with braces. And there's quite a few other things as well. But basically people want to smile nicely and be functional and have a good form, and among others.
Let's talk the politics of it, though. I hear a lot of people are complaining that medical aids don't necessarily cover that procedure.
Okay, those politics I can easily entertain.
Yes.
There's other politics.
Let's start with the small politics.
No, it's just sometimes it is regarded as cosmetics.
Is it though?
It can be corrective clinical treatment, whereby it is highly necessary, where someone's form and function and hygiene are compromised because of... you can imagine teeth that are very crooked, you cannot clean them.
Yes.
So hygiene is affected there.
Yes.
You can imagine certain situations where the palate is so constricted that speech is difficult. So there are many reasons why people do braces, and not all of them are cosmetic.
I see.
Yeah. And then also you may find it's a little bit expensive in certain instances, but some medical aids do go halfway and say, we'll meet you halfway. We're only obliged to cover you so much for this particular thing, and then we'll cover you up to this much. But then the rest you can see for yourself, and then so they do pay some medical aid.
You do say that braces is just one of the
ways. Yeah.
One of the ways.
Yeah.
What other ways can you do to solve such a problem?
Braces is called fixed appliance. It's fixed orthodontics. Orthodontics. There are other appliances that are not fixed. There can be aligners that are invisible that you can wear and take off. And then in minor cases, they even use things like removable appliances, whereby when a child is busy growing and there's a small adjustment that needs to be made to their teeth, as they grow, to guide them to grow in the right direction, they even use removable appliances. Yeah. So,
how expensive are they?
Removable appliances, the last ones that I mentioned that are used to intervene when children are still growing. Yeah. Mostly they are used there, or when even in adults when cases are minor. Those are fairly affordable.
I see.
And some medical aids even only pay for those. They don't pay for fixed orthodontics. And then the braces would find their way somewhere in between, but it's a long process. The treatment takes a long time. Yes. So you'll find with braces, the they can't be that cheap because there's
Yes.
a lot of work that goes into it.
Yes.
They may treat a patient for 12 months, 18 months, and you look after them 30 months, sometimes 36 months if it's a big case. And then with other removable appliances, the aligners. Those are very cosmetic and they are offered by companies that actually need machinery and stuff. Some people make them in their own rooms if they are lucky, and then they can fit them on the patient. So price is slightly higher than braces sometimes.
I see.
Yeah.
You know, when you're talking about the arrangement of teeth, I've seen people with a gap.
Yes.
And a gap used to be some fashionable thing in the past.
Yes.
But I see people closing the gap now, closing their gaps.
Yes.
Is that necessary, though? Is that important? If you were born, say, with a gap, why would you want to close it?
Aesthetic enhancements. Yeah. Aesthetic enhancements and gaps, they are mostly genetic. You find that there's a few people in the family that will have it. Yeah, some people say, I just don't want to look like Malume anymore.
Oh, yeah.
One or two people have said that. There's this relative of mine who has this thing, and the people identify it. Yes. So they say, no, we don't want it. And then, but it's an aesthetic enhancement. It's a functional enhancement for speech as well. People say,
because they will talk with the lisp.
It disturbs the way I speak, so I would like to get rid of it.
Yes.
And then sometimes a gap is uncontrollable. You cannot control whether it's going to lean left or right as the person grows up.
Yes.
You cannot control whether it's going to get bigger or smaller. Mostly it gets bigger. Then you lose control of your aesthetics there. Yeah. So then people get rid of it but some people just, it's an aesthetic and I mean, remember, patients come to you with the simplest of demands. They say, I don't like this. Yes. I want the best of this.
Yes.
So you find common ground and sit with them and say, this is possible. This is not a problem, but if you insist we must work on it, these are the parameters within which you can work.
I see.
So
you go through that exercise with the patient so that they understand,
manage expectations and also explain the biology and the science behind what you are doing so that you all want what you understand and understand what you want.
Yes. So in such an instance where somebody has a gap, what is it that you do exactly? Do
you bring the teeth together? And
also the teeth will be apart, so you bring them together.
And when you bring them together like this, they open a gap this side. Then you open. Then you close like this. Then you open. So
it's like a chain reaction of sorts.
Yes, it's like So after a few months, someone will say, "But I came for the front gap."
Yes.
And when now you open other gaps.
Yes.
But you say, but naturally, when we do this, it will be, take into account the whole mouth, not just,
So let's say you closing the gap here. The teeth on both sides of the gap have to
come together.
Have to come together.
Yeah.
And that then affects the rest of the teeth.
Yes, but you manage them. And that's why you must explain the science to say, this is what you must expect.
I see. The misconception is that you sort of grow a tooth to cover the gap. You don't do that.
Sometimes prosthetics has done a good job.
Prosthetics, yes. You did say.
To do that. In limited cases, prosthetics has done a good job to do that. So there are options. That's why you must sit down with the person and look at what's happening. If the gap is too big and you cannot bring all the teeth forward to close it, you might as well just think of other options of giving an aesthetic result without doing... with that incorporates the patient's main complaint.
I see. Yeah. Speaking of prosthetics, you have a big beef with gold teeth.
Is that prosthetics?
I don't know. You tell me. You tell me, because back in the day, you would know. You would have the most popular people sporting gold teeth. Yes. In fact, it was so popular that even in taxi ranks, you'd have people installing gold teeth. Yes. What is it about that you find so objectionable?
Gold has room in dentistry. Some people that don't do permanent damage to their teeth use grills for fun.
Like
It is purely for fun.
hip hop cats.
Yeah, no, it's fine.
Like my good friend Lincoln Ngube, who's running the podcast, he's a hip hop cat. Yeah.
Yeah. So you can get grills and have fun. It's fine. There's no permanent damage to the teeth.
I see. Are the grills permanent?
They are removable.
Oh yeah.
Just like
so what in?
Yeah, just like your gum guard or
see.
your whatever. Yeah. So the problem with gold is that you have to break enamel to install gold.
I see.
There is room for gold in dentistry. There are certain teeth that can only be treated with gold crowns, especially at the back. There's less and less room for it now when the other tooth-colored alternatives have improved in terms of availability, strength, and other qualities that you would look for in a prosthesis. Now, in front here, in the long, long past, when you used to grind your teeth, or there used to be damage to the front of your tooth, when there were no suitable tooth-colored replacements that could fill that gap, gold used to do a good job. And this was therapeutic. No one went in and said, I want aesthetics to improve and I want gold.
I see.
So in those instances, they would put a gold slit. And then we strayed a little into putting gold slits, even in instances where we had to break enamel to accommodate the gold, not because there was something wrong, but because a patient demanded something that they thought was aesthetically appeasing.
No, you don't say this. So somebody comes with a healthy tooth, as it were.
Yes.
And they tell you, listen, I want
you
some gold on it.
Yes. To make room for that, you have to shave it. And enamel is the hardest.
So you shave the tooth on the edge?
Anywhere where they want it.
I see.
If they want a full gold, you do a full gold. And what's said with a full gold coverage veneer is that it can only be replaced by another veneer. So you cannot just put a small nyana, they call them composite fillings.
Yes.
Because even the quality of composite is not as good as your enamel. So it will never, you can't scratch your car only to paint it tomorrow. You understand? Okay. Yeah. So it damages, enamel is the hardest material in your body.
Is it harder than bones?
Yeah. Enamel is over 90% calcium, metal in general. And the bone is in the 60s. So it's enamel is hard. So for you to damage it just to put something, and then when you are 30, your child starts saying, hey, what's that shiny thing? And then you want to remove it.
Yes.
So when we know the full cycle of what happens, we now say, I think it's advisable that we tell people, sit them down and say, here are your options, and don't do it. And then they say, yeah, but I want it. But luckily in our practice, we actually remove it and replace it with tooth color material. Not all our replacements are as successful because sometimes the deficit of tooth that's gone is too big to replace with just a normal small filling. So it requires something that costs you over 6,000 rand to replace the damage that was done there. So please don't do it.
Yeah. I've seen people who got their gold teeth installed in taxi ranks, and they start having health problems, gum problems, and what have you.
The gums may be reacting to the material. The reason why gold is a good material is because most tissues in the mouth don't react to it. If it's good gold. If it's bad gold,
it must have been bad, fake gold.
Agree. Sometimes we take this copper from the cut boxes. Even for cut boxes, they just bend it and then put it in there. And then also it creates little crevices where hiding areas where bacteria can hide and plaque accumulates and it compromises the cleaning of your teeth. Yeah. If it's done properly, it's fine. But if you don't need it, don't do it.
When we started, you say your main focus is oral health. Mm-hmm. Why is oral health important?
Oral health is important because we have a lot of oral health problems that are highly preventable. So oral hygiene education is actually very, very important, which is why I didn't miss an opportunity to mention that we do go out into communities speak on radio, speak on TV, newspapers, magazines, to try and give information, to say this is preventable, avoid this and that, and you'll be fine. So the education is very, very important. Then oral health is important because the mouth is the gateway to your body. You are what you eat. If you can't eat properly, then what's going to happen to you? Yeah.
So let's talk proper hygiene. Like, what's the correct routine to implement? Brushing teeth in the morning.
Yes, sir.
Right? Somebody tells me that, in fact, when you're brushing your teeth, you've got to go in a
circular motion.
Yeah. Why?
Not
is that?
very easy, but you have to master it. Try
Yeah,
and master it. Yeah. Because when you go in circular motion, I'm trying to think of the word. It's rotation. It's oscillation.
Oh, it's oscillation.
Yeah.
Yes.
I'm trying to relate it to the latest toothbrush offerings.
Yes.
If you find it difficult, buy an entry level electric toothbrush. It can do it for you. Entry level. I didn't say 2,000.
Yeah.
You can get one for 200.
So you shouldn't break the family bank.
Yeah, no. And see how it goes. The circular motion thing. You go in circular motions because on the one hand you want to brush your teeth. On the other hand you want to massage your gums.
Massage your gums. That's a new one.
You rejuvenate the gums. You have to have new blood flowing into the gums and old blood being carried away. So that thing that happens when you massage, you freshen up your gums as well.
So
with a soft toothbrush.
With a soft toothbrush. Yeah. So you do that in the morning?
And in the evening.
And in the evening?
Practically speaking, that's enough.
Oh.
And then you floss as well.
You don't have to do it like 4 times a day.
No, that's not practical. You and I know.
Of course. But let's talk this flossing thing that you're talking about.
Yeah, you floss once a day or every second day.
Flossing is the string that you put in between teeth.
Yes.
And, maybe I'm talking old-fashioned
No,
ways.
there's strings and there's little, the ones that are attached to a plastic toothpick.
Yes.
Then those are easier to manipulate.
Why are people supposed to floss?
Because when you clean, you don't clean 100% with your brush.
I see.
When you clean, you don't clean 100%, and then in between the teeth, you still need to clean with floss.
Also, there's dirt that sort of accumulates in between the teeth.
Yes, plaque that accumulates between the teeth, and you're not fully done and then brush your tongue as well. Yeah.
Why the tongue?
Because it accumulates germs.
I see.
Yeah.
So when you're brushing your teeth, you've got to include the tongue as well.
Yes.
I see.
Yeah.
But you don't have to brush your gums.
Your gums you brush as you brush your teeth in a circular motion.
Yes.
The funny thing about these new brushes is that there are some that are connected to apps, and it can give you an entire month report of how you've done, how you were brushing. And you can submit that to your dentist just to impress them. So they also have ones that even tell you they can sense the amount of pressure you are applying on the teeth.
Really?
Yeah. If you're brushing too hard, it tells you. It tells you, and then that too can produce a report. So
you gave me a wonderful tip. You say the mouth is the gateway to
your body.
To your body.
Yeah.
You are what you eat.
Yes.
Now let's talk about that. Are there any particular foods that a person should be consuming or should not be consuming?
Okay, healthy food as prescribed in any health write-up that you can read about.
Fruit, vegetables.
Fruits, vegetables, nuts are good. If you're not allergic to these things. So then the ones you should avoid is sugary stuff, sticky stuff, toffees. You cannot live on chocolate. Some people say it's got cocoa and it's got this and it's got these benefits, but the sugar in the chocolate does more damage than good.
So ideally, people should be avoiding chocolates.
Should be avoiding all sugary stuff. Limit it. It's bad for your diabetic prospects. It's bad for your,
But what does it do to the tooth?
But sugar.
Yes.
Sugar, when it lands on your tooth,
Yes.
it combines with certain elements from saliva,
Yes.
and it makes acid, and then acid starts eating into the tooth. In actual fact, if you do not eat sugar, chances of getting decay on your teeth are close to zero. Sugar in all its forms, by the way, or in bread, in yogurt, in things like that have sugar, in all the offerings that have sugar.
You're not only talking sweets, you're talking like all...
the full spectrum.
Yeah.
So that's why you must read the labels when you buy food. Does this contain sugar or not? Yeah.
Now, there's one thing that we have to talk about, halitosis. I think that's the medical term for bad breath.
Bad breath, yeah.
What is that?
Bad breath is the smell, odor that comes out of the orophacial, oronasal area. Yes. In the area of the nose and the mouth. You could emit a smell that's just not pleasant. Yes. That's indicative of something wrong somewhere. So it could be from anything from your sinuses to your gut. Your tummy, your gut, your stomach.
Yes.
Then there could be soreness in the eating pipe, the esophagus, and you find that it emits some smell. There's wounds in there that came in. That's more rare. The most common one is when you have bacteria either in your teeth or in your gums that's growing there and causing disease, and it produces a foul smell. Yeah. Then in other instances, it could be your sinuses. The most terrible one is the tonsil stones. These are terrible.
Tonsil stones.
Yeah.
What
Little white granules that you find
towards the back.
Yeah. Yes. If you take one and you break it, it smells even when you put it in front of you.
Jeez, man.
Imagine they are packing there all the time.
Yes.
Yeah. So it could be anything to do with your sinuses, your teeth, your gums,
but wait, Doc,
or your gut.
The tonsil stones, and I'm getting concerned here. What causes them?
Without trying to stray into other people's terrain, my simplest explanation to patients is that your sinuses and your tonsils, your sinuses are your sensors, your tonsils are your filters. They're meant to trap things here before they go and make you more sick somewhere else. And if there's some infection in here, it collects here, the tonsils try and guard the way to the airways. And that's where I'll end it.
But all these things are treatable.
Yeah, then the tonsillitis is treatable. Yeah, it's treatable by medical practitioners. It's treatable by surgeons when it requires surgery. So, but the first point of call should be your regular doctor, medical practitioner.
But can a patient come to you and present themselves with halitosis? Is it halitosis?
Yes.
In every are they supposed to come to a dentist? That's the question.
They're supposed to consult somebody.
I see.
But we are the closest ones to pick it up because in the majority of cases it involves the oral health. So we improve brushing habits, we improve dietary habits, then we improve if there's anything that needs to be restored in the mouth, we restore the teeth. If there's any guidance needs to be given as to the health of the gums, we give guidance there. And then after we eliminate problems. But we will be honest, if we see that your teeth are perfect, and we can tell it's not from the teeth, we can tell it's from somewhere else, we will quickly guide you and say, now we're not going to mess around with your teeth because you need help. Go somewhere like this and that and then get this sorted.
Could it be a question of genes as well? Is genetic?
Not necessarily the halitosis, but certain things that are associated with it. Like people that have allergies generally, seasonal change allergies, would find themselves with other people. I know my kids have seasonal allergies and I have seasonal allergies. And I ended up with asthma and stuff like that. And I was very vigilant to try and avoid them getting asthma as well.
Or you could avoid
getting asthma, if you treat your... I've had a GP say, if you could treat all your sinusitis early, you can actually avoid your bronchitis getting affected.
I see.
Yeah.
I see. We spoke of diet, but we also have to speak about something very popular, alcohol.
Yes, sir.
Why are you smiling?
I'm not getting thirsty, don't worry.
Yes. Is it bad for oral health?
Alcohol, if it incapacitates you, it's bad for everything. It's bad for your health in many ways. So in moderation, I would be safe to say that. But people that drink to the extent that they throw up,
yes.
Sometimes the alcohol affects their teeth. The acid that comes up with the vomit affects your teeth. So people that have vomiting tendencies do have weak teeth. They have bad teeth that have been affected by the acid that comes from the stomach. That's one element. But if you drink so much that you forget your routines, it's also bad for your routine. It's also bad for your teeth, your health, your oral health, yeah.
And tobacco?
Tobacco is number one enemy for everything.
Tell me more.
Tobacco stains your teeth. Tobacco predisposes you to cancer, oral cancer. Tobacco, this is just...
Also, there's oral cancer as well.
Yes.
There are all sorts of cancer.
No, cancer, remember, is cells that tend to multiply the wrong way. Probably in the right area, but the wrong way. So then they are isolated as cancer cells. And then they can travel around the body. And they say that cancer has traveled everywhere else.
Yes.
So it can land in the tissues of the thing. But it can start in the mouth where you have cancer of the soft tissues of the mouth, cancer of the bone.
No, that's interesting because when we associate smoking with lung cancer alone, but
it's the gateway to your body.
Oh.
The smoke goes through the mouth.
I see.
So it leaves no stone unturned.
It
goes through the mouth. Yeah.
I hear you.
So it's got carcinogens, elements that encourage cancer formation.
Yes.
Tobacco.
I see.
So, and the other way, the ways to identify these, it starts sometimes with white patches along the tongue, somewhere on your soft tissues. Then when you see those, you must quickly, I hope they get identified when you do your regular checkups with the dentist. Yeah. I
see. So, but your advice is that people should avoid smoking.
Yeah, look, smoking, if you can avoid it, don't do it.
There's this fancy way of smoking now. Lincoln, you'd have to help me out. Hubley, yes.
Yeah.
Vaping and hubley.
Yeah.
Are they as bad as the normal smoking that we know?
That's political. It's controversial.
Yeah.
I'm not an expert on the subject, but I have heard that they are bad. They are not as safe as some people make them out to be.
Yes. Yeah. Yes. So they could be just as bad to oral health as the conventional.
They could be just as bad to your tissues. There could be carcinogens in the smoke that comes from the thing. Plus, we know that vaping, especially hubblies, they transmit certain viruses like herpes. And some tools are very clean, some may not be.
Yes.
So some of the tools.
What worries me is that I think they use the same thingy to
interchanged.
Yeah, so it could be like 5 people smoking the same thing.
If you complain about cleanliness, you are not fun.
You
are boring.
Yes. Yes.
So they are known to transmit herpes.
I see.
Yeah. They're hubbly tools. Yeah.
Yes. Now, we've established that one should brush one's teeth twice a day, in the morning, in the evening.
Mm-hmm.
Is there such a thing as over cleaning your teeth? Perhaps?
Yes, if you use a hard toothbrush too hard.
What kind of a toothbrush
must
should
be soft all the time?
The bristles. The bristles.
Yeah, must be soft. I sometimes say the bristles that they use to make hard toothbrush are the same ones they use to make a scrubbing brush. So You can imagine.
Yeah. So they've got to be soft, and when you brush, they've got to go in a circular motion.
Gently. Gently. Anything hard, consult. Because then we need to look at it. Focus only on the hard material, that calculus or tartar. Then remove it carefully without harming the rest of the surrounding tissues. If you do it yourself, you can even remove enamel, you can harm the gums if it's too hard, But that's if it managed to survive long enough in your mouth to harden.
Yes. There are people who have is it bleeding gums?
Yes.
Is that a problem?
It is a problem in many ways. Remember, bleeding gums is an indication. Anything bleeding is an indication of not being well somewhere. So it's an indication of gum disease in the simplest form. It could be other things, but it's gum disease, and then you will have to get assistance. But remember, bleeding gums have other implications. People with diabetes have weak gums that get easily diseased. So it could be an indication of something underlying somewhere. But the bleeding gums, they inoculate. Like with vaccines, we inoculate you.
Yes.
Bleeding gums inoculate your bloodstream with bacteria. So meaning they dump bacteria into your bloodstream that does not belong there. And when it goes to vital organs like your heart, your brain, it can encourage something that looks like cholesterol in your blood vessels. So meaning it clogs up your blood vessels. Then you can get strokes and heart problems because of something that started with bleeding gums. People listen better when we say for ladies it can even cause you problems with conception. You may find it's difficult to conceive babies because...
just because of bleeding gums?
Because it tampers with the process in the uterus. And then it can even cause premature labor. It can even cause miscarriages, as literature says. And then with gentlemen, it can even cause erectile dysfunction, bleeding gums.
Just bleeding gums?
No, I think that's usually the gentlemen who ignore our content. When you say this, they say, what?
But
yeah, so it does that, unfortunately.
Oh, no. Now I've just remembered. People, when you're talking bleeding gums, toothpicks.
Yes.
Apparently, toothpicks are not as kosher as we make them out to be.
They are difficult to use. In most instances, used by children. They break in.
Yeah, like the wooden toothpicks. Yes. Yeah. Are they good or are they not good?
Look, if used carefully by an able-bodied person, they can work okay. They're not ideal. Floss is better.
Or ideally, you should be using flosses.
Yeah, that's an opportunity. It's a cue for you to floss.
I see.
Yeah.
I see. Now, when we started, you were like, no, I'm doing dentistry, but I'm not enjoying it, or I'm enjoying it, whatever. I want to hear from you. An aspirant professional there wants to study dentistry.
Yes.
What would you advise them?
They must do it. They must do it. There's room for dentists at all levels.
Yes.
In the past, they were pioneers who came before us. Then we were happy they were the first black dentists.
Yes.
And then later on, we were consolidating our presence in townships. Yes. We made a difference.
Yes.
I worked in Kwakwa for 17 years.
That's home, by the way.
Yeah.
Mm-hmm.
And so you can make a difference in people's lives. You can do all these things that you say you can do. Then you relieve pain. You are.
Yes.
We were. There was a time in certain institutions where they were very eager to train people from rural areas because they knew we had a tendency to go back home.
Yes.
And I was proud to be one of that crop. So yes, young guns out there, do it. And if you have a temptation to go back home and work for a few years, life doesn't begin and end in the cities.
Yeah.
If you would like to serve your communities, go ahead and do it. Yeah.
And if you're talking young guns, they have to excel in mathematics and biology.
I never excelled. I don't want to lie.
You don't say.
I had to take a detour through BSc, this and that, prolonged curriculum. 1 year I was doing IT, and then
You've been all over the place, man.
yeah, and then but 1 year only, and then I started improving my performance at varsity, and then it's important to tell young people that you can take a detour and end up somewhere else. There's no straight route.
Yes.
If you have a straight route, you are lucky.
Yeah.
You know.
Yeah.
So then I started improving my performance in these science subjects, and then I got accepted for dentistry. Yeah.
I see. And you say in your time it was five
and a half years.
Jeez, man.
This was 1991.
It almost like medicine, because medicine is 7 years.
It was 6 years.
Yes.
Then we did the half, and then they do the other stuff. But it's changed a lot with community service and internship. We do the community service, but not the internship.
Yes.
Yeah.
I like, but I have to let you know, I have to have you know that oral health is probably the most neglected, thing. And it's a pity because it's probably one of the most preventable and one of the most important, right?
It is.
Yeah.
You practice the basics right, stay away from sugar, 80% of your problems are gone.
So you're adamant we have to stay away from sugar?
Yeah, it's good for other reasons as well.
Yeah.
Yeah. Maintain your weight. Weight is a problem.
I see. I hear.
I see you maintaining it well.
I take after you, Doc. The Professionals Network podcast. This is a platform where we like what we say and we say what we like. The Good Doctor, ladies and gentlemen. Thank you very much.
Thank you for having me, sir.